Oksana Pyzik is a lecturer at the UCL School of Pharmacy and Global Health, as well as being a global health advisor. She joins us now from London. Oksana, thank you so much for your time. When we talk about this global health treaty, is it a little too late to try and create this when some countries don't want it to be legally binding, and some nations are already actually choosing not to follow the advice of the World Health Organization?
Well, certainly it would have been preferable to have this type of detailed treaty already in place. And it highlights how the international health regulations were not really fit for purpose, as this new treaty or agreement highlights. But it isn't without opposition, and they do need consensus in order for it to have true effect. But we do see the need for it based on the fact that 1 year later, since vaccines have become available, we see that over 60% of all vaccines are in high-income countries and less than 3% in low-income countries. So vaccine hoarding is something that we need to expect and plan for and have instruments to prevent in future. So although the damage is done in terms of the numbers of lives lost already, something like this could help in future with, as we know, the threat of outbreaks will continue. So I don't think that, if anything, there's so many lessons that we have learned that should be applied towards this treaty, and for all countries to cooperate, which is a big ask, of course.
What are some of the most important lessons that we've learned during these last almost 2 years during this pandemic?
Well, certainly, if we look at making sure those mechanisms on the ground are fit for purpose for vaccine distribution. So while many political promises were made, including funds which governments promised towards countries, that didn't actually translate into vaccines. So we also see that business as usual approach, protecting patents, also slows down the process in vaccinating the world. We're relying on 2 companies to create all the mRNA vaccines. So again, looking at what TRIPS waiver and flexibilities exist, and ensuring that if there is an agreement going forward, that approach would not be possible in terms of just having such a limited amount of companies being able to produce vaccines. That's one of the lessons. Also, speed, ensuring that countries share information as quickly as possible. We see that South Africa has done a phenomenal job in their scientists doing the data, the genomic sequencing, and getting that data out there. We do know, however, that originally there was at least some delays coming out of China that did have similarities to the original SARS outbreak in 2003. So a bit of a repeated pattern on that front. So definitely speed, ensuring that there are negotiations in advance in place between pharmaceutical companies and countries, so that we don't end up in the same situation that we have again, and to keep messaging clear and consistent. Now, that is very difficult. The misinformation aspect of this pandemic is much harder to combat than the virus itself.
Yeah, we've still got a long way to go to definitely combat that misinformation. Oksana Pyzik, much appreciate your analysis and your time. Thank you so much.